Good morning, everyone, and welcome.
Good morning.
Um, we are so glad that you are here today and that you've joined us for this CME training. We have a tremendous day of activities planned for you, and while we're disappointed we cannot do it in person, we're also glad that that means that there are people who are joining us from other parts, from all over the U.S. We've had a tremendous interest in this topic and this conference, and so we look forward to a very productive day. My name is Dr. Naina Harawa. I direct the Policy Core for CHIPS, the Center for HIV Identification, Prevention, and Treatment Services. I am a professor in general internal medicine and health services research at UCLA and also in the School of Medicine at Charles R. Drew University of Medicine and Science. I'm just going to be giving a brief introduction to our day and then turning it over to our fabulous speakers. We've embarked on this interesting journey addressing this topic of medical mistrust last year in November, and it's become more and more important because the current environment has created new reasons for mistrust and distrust all over the country. And so I find it particularly profound that we're at this moment when there are so many forces that are contributing to mistrust, distrust between groups, and heightening or making many people understand at new levels why it is that many in Black communities feel specific types of mistrust related to medical institutions as well as other institutions of our society. But I'm still hopeful that we can make some progress by looking at our own actions as providers and researchers and and other types of service providers, as well as at the institutional and systems level. So for a few housekeeping notes, we ask that everybody mute your mics. That's very important so we can, of course, have a discussion where everyone can hear. There will be time after each of the speakers to ask questions. However, we realize we will not be able to get to all of the questions. Myself or one of our fabulous planning committee members will be directing questions to the speakers or the panelists at the end. But if you have a question, we ask that you go to the chat and select the item that literally says questions and send your questions there so we can sort through and answer them. And we'll do our best, if we're not able to get to your question during the day, to answer it via email later. We will also have a discussion, more of a discussion forum at the end. And so there's a short time after every speaker for questions, but there will be a little bit more of an open time at the end. We also encourage you to use the speaker view when presentations are happening, just so you can see the speaker and the slides well. We also encourage you to look at the chat. We will have some important links that we post there, particularly when we go to the breakouts. There's links to specific role plays that will be there, so please click on those links so you can have that information when we go to the breakout rooms. Okay, so I am just about ready to introduce our first speaker. But I just wanted to say a little bit more about the agenda first. We're going to start our day by talking about how it is that we got to this point in terms of the experience and the perceptions of many in the African American community of the medical system, and what it is about these systems and these histories that have created that atmosphere. And then we will have a panel of community members and providers. Then we will have a short breakout where you will meet the people who will be in your breakouts. There were 3 breakouts today, and you will meet the other individuals who are part of those breakouts and do a brief introduction. At the end of the breakout, there's a short 10-minute break. We do encourage you to get up, move around, move your body. This is 4 hours, so it's not good to spend all that time sitting by any means. After that, we start a discussion of strategies for overcoming mistrust, led by Dr. Bogart. And Then we will have two specific, more disease-focused discussions. One talks about mistrust in the context of COVID, led by Dr. Fields, and a presentation about mistrust in the context of sexual health and hepatitis and STI prevention and treatment. At the end of each of those two sessions is when there's opportunities for breakouts and role plays and starting to practice some of what it is that you learned in the day. We will close the day with a repertoire session, questions and answers, and further discussion about solutions. As you will learn, this isn't an issue that has been taken head on a great deal, and so it's exciting to be taking it head on, but at the same time we're learning from everyone who will be part of this discussion. We've also learned a great deal in the planning process, that our goal is to continuing to use and feedback to various leaders within the healthcare system so that systematic issues can also be addressed in the process.